everybody. My name is Andrew Gumpert, for those who don't know. I'm the co-chair of tonight's event as well. I just want to take a moment and introduce two lovely families that are here tonight. It's my pleasure to introduce the Gomez and the Clawin families, who we just saw in the video. If they could just please stand up. They're here. There they are. They're in the back. Thank you. So I want to introduce Dr. Rao, but I was going through last year's, I call it the letter book. For those of you who were at the dinner last year, we actually put together a book. It was a compilation of letters that was written by kids suffering from epilepsy and parents and siblings. And I came across one letter. It's dated June 5th, 2012. I'm not going to read the whole letter, but the young boy was 5 months old when he was admitted to UCLA, and it's a terrible situation. He had infantile spasms. He actually went into a coma. He was aspirating. He had to go into the pediatric intensive care unit. And in pertinent part, this is from the mother. She wrote, "We're so thankful for the amazing doctors and nurses at UCLA and the incredible care they showed to not only our son, but our whole family. Dr. Rao has been Blake's neurologist from the beginning, and we just love her. She is always there and responds to all our emails and questions. Thank you for making it possible for my son to have such a great doctor." And it hit me. I saw the video, and I just thought it was a little touching moment to share that with you. So with that, I would like to introduce Dr. Rao. What we're doing here, as Mark said earlier, is finding doctors who really are not only those who possess incredible academic and medical acumen, but really have extreme compassion for their patients, as you just saw. Beyond that, and in Dr. Rao's case, I can speak firsthand about it, there's an amazing inner drive. So much so that at the end of her first year of her epilepsy fellowship, which, by the way, for you non-doctors, is probably one of the most demanding, time-consuming fellowships in all of medicine, Dr. Rao also managed to find time to give birth to a beautiful baby girl named Maya. Talk about perseverance. So with that, it's my distinct pleasure to introduce you, Dr. Rao. Can you see it?
Hello, everyone. Good evening. I'd like to thank Andrew for that wonderful introduction, and thank you also to Mark for inviting me to, both Andrew and Mark for inviting me to speak to you today. I also wanted to thank my husband for being with me the last 6 of the last 7 years that it takes to become a pediatric epileptologist. He has really supported me both emotionally and financially, and I literally mean financially. He's paid for 2 of my board exams. So he's a wonderful retina specialist, Dr. Pradeep Prasad. I also want to thank Nate and Charles for making me look so good in that video. I wish I could say I can take that much credit for Audrey's success, but really I think that the credit should go to Jen Clawin. Because now, as a mom myself, I understand the power of a mother and the power of a mother's love to recognize when your child needs something and maybe needs something a little bit more than what's being offered. And she really went the extra mile to find me. And without her perseverance, I don't think that they would be sitting here today. I don't think that Audrey would be going to school, reading, and doing everything a normal 3-year-old should do. So I think that Audrey is lucky for 2 reasons. First of all, she has an amazing mother in Jen. And second of all, she lives in Los Angeles, or in Los Angeles County, where we do have amazing pediatric epileptologists. And I'm happy to say that I am going to continue here at UCLA as an assistant professor, thanks in part to Karen Cure and also the veritable force of nature that is Dr. Sankar. And those of you who know him, he can make amazing things happen. But not everyone is so fortunate to live in Los Angeles County. And I'd like to tell you the story of another one of my patients, also with infantile spasms. His name is Angel, and he lives in a different county where there's only one pediatric neurologist. I met him in December of 2009, just before Christmas. When he was 3 months old, he started having these strange hiccup-like movements. They would be when he was lying in bed, just before he fell asleep, or just after waking up. His pediatrician thought maybe this is due to reflux. They switched his formula. They referred him to their local pediatric neurologist, but there's only one in their entire county. The spasms went on for 2 weeks. He got an EEG, and it showed hypsarrhythmia. For those of you that are unfamiliar with this term, it's a chaotic pattern on your EEG. If you can only imagine, you're trying to listen to a symphony, but every time it comes to the climax, there's a chaotic beat or there's static through your headphones. That's what hypsarrhythmia is. It prevents you from listening to that symphony. It prevents you from moving on and developing. Shortly before Christmas, he came to us at UCLA. We confirmed he had hypsarrhythmia. We confirmed he had infantile spasms. We started him on ACTH, the same therapy that Audrey received. And within 2 weeks, his spasms stopped. He had stopped smiling, stopped holding his head up. When the seizures went away, he started smiling again. He started holding his head up. But ACTH is not a benign therapy. It comes with a lot of risks. We have to taper it off. During the taper, his spasms returned, and he stopped smiling. He stopped holding his head up. His mom called me in a panic, but there was nothing else that I could do except try other medications. Eventually, we tried another round of ACTH. Again, 2 weeks in, he started to respond. He started smiling again. He started holding his head up again. But like the course before it, ACTH had to come to an end, and the spasms returned. Now he's almost 4 years old. He doesn't smile, he doesn't walk, he doesn't talk, and he requires a tube to help him feed. Now, could we have gotten to him earlier? If there was more than one pediatric neurologist in his county, would his parents also be sitting here with us today? That's a question that I can't really answer. But I do know that with Karen Cure and the Epilepsy Foundation, we can provide awareness in the community so that even though there aren't pediatric neurologists or epileptologists, they'll know what an infantile spasm looks like. They won't diagnose it as reflux. And possibly we can work towards having more pediatric epileptologists in the community, have telemedicine, other ways of reaching these practitioners. And I think together we can really, really make a difference. And I thank you very much for your support tonight, and also to the Epilepsy Foundation, without whom I wouldn't be standing here today. Thank you.